Welcome to another episode of Finding Your Joy. Paula Vail here. Welcome for joining us today. Happy Tuesday. Happy 2018 again. It's so exciting. I am so happy to share with you today Dr. Austin McMillian. He is a well-known chiropractic physician in Washington State, and his practice is in Tacoma, Washington. He has helped patients from around the country. His area of expertise is in injury care, pain relief, and functional rehabilitation, all key areas for health. First off, welcome, Austin.
Thanks so much, Paula.
Happy.
It's great being here with you again, and from the time from before. It's a great day. It's good to talk to your listeners.
Yes, I have interviewed Austin over the years and just absolutely adore him. He's
Thank you.
fantastic. I've had the honor of going to him. I needed assistance myself due to an injury, and he is absolutely amazing. So,
Well, and I was honored to help you. My whole staff was honored to help you. It's always great to be with you. So this is going to be fun.
thank you, Austin. Thank you. Well, I would love to begin today with talk about, pain relief and, how important that is for us to be able to relieve ourselves of that. And
Well,
let's
pain
talk
relief
about
is it's such an important part of life. We all go through it one time or another. We manage patients with pain every day, both acute and chronic. So really the importance of that is that it improves the quality of life overall. It allows you to be happier, which I think fits right in with the topic of your program, and it allows people to have a more active lifestyle. So, I'm in probably close to 30 years in practice. I hate to say, tell my age, but pain relief has really been a central part of helping my community and people that come to us for help right from the beginning. We use chiropractic care for that. It's a very it's an outstanding avenue to try and help with musculoskeletal pain relief, muscles, joints, particularly the back and the neck. I think that's what most people associate chiropractic care with. But there's a lot of other things that can enhance the success of that, and we really reach in and try and help that out.
yes, yes. Awesome. And, it is life-changing to be able to make a difference for someone with pain relief. I know from personal experience when I was in a lot of pain due to my car accident and my neck injury, there were times I thought I can't go on.
Right.
And to have someone assist you with that and help you with that, you're changing lives.
Well, I like to think that we are, and of course we get very good feedback. I think that looking at the natural directions for pain relief is more important now than ever with the opioid crisis that we all, I think, are very aware of. The risks of that. I think most people are not aware of the fact that the risk of addiction to opioids starts at 3 days. So, past 3 to 5 days of opioid pain medication as an effort to try and manage pain is really not a very wise idea, really. The former director for the Centers of Disease Control really said that opioid medication should be reserved for things like the chronic pain of cancer, like end-stage cancer. And that no other medication for non-fatal disease kills people as frequently. It's really a high-risk thing, but yet it's prescribed all the time. And so getting people to look at the natural directions for pain relief, I think, is one of the most important conversations that we can be having. It helps them get on track better and faster in a more natural way, in a more productive way, and moves them to a better quality of life. So I really can't think of anything more important in terms of reducing risk for patients than having the natural care conversation. Chiropractic care is part of that, and then the other things that we do to enhance the success of chiropractic care and mechanical pain management is also critical.
Yes. What would you say are the top choices that we can take to do a more natural alternative care to pain?
Well, I always come back to the basics. I talk to my patients about making sure that all of the basics are covered well, starting with things like sleep and diet and stress relief and things like that. Those are so important. But when it comes to where pain starts, for many people, it might be an injury. It might just be a spontaneous spot of pain, um, coming in and starting naturally is really important. I was down in Olympia yesterday testifying before the legislature regarding alternatives for pain management in their conversation about what to do with policy regarding the opioid epidemic. And the people that I was on panel with, the groups were um, naturopaths, massage therapists, acupuncturists, and physical therapists. Those are all natural care professions. They're all trying to help naturally. They're non-prescribers with the exception of naturopaths, but they also focus on natural prescription. So there's many directions. But of all of those, the chiropractic care is the one profession that actually is focused on proper movement and movement control using some of the key things like skilled manipulation or skilled adjustments of the spine or joints to try and help restore movement. Movement therapies have been shown to be 20 or 30% more effective than the opioids or the medication directions, just on face value,
Yes.
right? So what we can do then is start to look at starting with those therapies first. And in many cases, patients respond very well just to that. But in my practice, what I've always tried to do is really kind of push the envelope and really do a better job as best we can. And in some of those areas, what we're now using are some of the cutting edge cold laser therapies, the high intensity multi-wave lasers, which are really painless as a procedure to have done. But they also are responsible for promoting tissue healing, for energizing tissue so that it recovers better and faster, for pain relief, for inflammation resolution, for things that are really helpful in getting through the pain. But as a next step, one of the things we need to do is make sure that we're promoting what I call functional fitness, which is kind of like a conditioning thing, to make sure that we're not just alleviating the pain, but really trying to make sure that we're getting to full and long-term pain relief and improved fitness.
Yes, I love that. And I love the idea of not just relieving the pain, but doing things for our body that's going to help the tissue heal and help the body repair itself, not
Right.
just pain relief.
Well, I think that when we actually dig into what the clinical research says, that gives us a lot of information to make better decisions. The clinical research for a long time now has shown that pain actually causes a toxic effect in the nervous system. There are studies from the Journal of Neurology, for example, that shows that pain, especially back pain, can actually reduce the size of your brain. The equivalent, a 1 year experience of pain or 1 year pain problem can reduce the size of certain areas of your brain by as much as the same as a 20-year aging process. So the conclusion of that article was that pain has a toxic effect on the nervous system. We also know that as soon as pain starts, it changes movement. And that's really at all levels through the nervous system, all the way out to the, at the local area of pain and every other area. So it alters the way that things move. When the pain goes away, your nervous system doesn't just turn things back on properly. So it's important to reactivate that in a way that is that's kind of restoring the normal function of the body.
Yes.
We also know from the research that pain promotes something called muscle atrophy. Thinking about atrophy, it's kind of like if you have a cast on your arm too long and you take it off and your muscle is shrunken up.
Yes.
Or the muscle is weak from, for example, paralysis. That's actually what happens to some of the deeper areas of the spine around back pain. So if we just cut the pain off, but we don't take the extra step to try and reactivate the muscle properly in the way that it normally works, that actually has been shown as the reason that the pain comes back. So the researchers are now using a set of terms that I equate to cancer in the way that they describe cancer. They're describing that back pain actually goes through what we call remissions and relapses. And in between the relapses, or when you're actually in pain, if you don't take care of it properly, the pain goes into remission, meaning it's still kind of there, but under the surface, and it's ready to come back. Yeah. And so it's really important to take the steps, just like with cancer, that you're driving remission all the way down to a cure as much as you can, or restoring it back to normal. And that's where the proper exercise, the right exercises, are something that we've been investigating for many years, and in fact pioneering new ways and better ways to try and activate the musculature or the function along the spine in particular, to make sure that we're actually drawing out um, the full functional fitness and trying to get everything as healthy as possible.
That is absolutely fascinating. That is amazing.
Well, I was surprised when I read the research, and I've also been surprised to see that when we're actually using new and better exercise strategies, how simple they are,
Mm-hmm.
how patients respond well to them.
Yes.
It also makes good sense for patients. When we bring the exercise in, it's not just in office in a supervised setting like in therapy, but we're actually extending that into home care,
Yes.
so that
Yes.
patients are doing a really good job with that at home and they can continue.
I love it. I love it. Oh, well, everyone, we're going to pop out for a commercial break, but we will be right back. Don't go away. Thank you.
I feel it in my fingers.
Hello, everyone. Paula Vail here, host of Finding Your Joy. Are you looking to open that beautiful door to Reiki energy healing? It is just absolutely life-changing. I have been a Reiki teacher, practitioner for many years. I'm so honored to help others learn that beautiful modality, also helping practitioners rise to a higher level of training. If you would like more information about my classes, check out www.wellnessinspired.com. Thank you so much. Have a great day.
Hello, everyone. Welcome back. If you're just joining us, I am here today with Dr. Austin McMillian, and he is an expert in pain relief. He's a chiropractor in the Tacoma, Washington area. He has traveled around the country. And it's just fascinating what we're talking about today, Austin, is especially with what's going on with opioids and the amount of pain in this country. And you mentioned earlier the natural alternatives that we can use. I would love to continue with that discussion. I find this fascinating, what the effects of pain on us and our choices.
Yeah, the choices are really critical, and I think an important thing for your listeners um, would be to remember that it's never too late to start making good choices. So some people may be on a particular pathway or an avenue that might not be suiting them well, that might be inviting recurrent pain, might be just dealing with the pain, but not actually dealing with the underlying fitness part of the equation, the picture. But it's never too late to get started with that. We help patients that come into our office with first-time pain episodes, and then people with, I've had patients with 3, 4, 5 fusion surgeries, for example, where the situation may not ever be able to be returned to normal, but we can actually draw out better fitness and help with some of the residual pain relief, even with natural approaches then.
Mm-hmm.
So two of the things that we've been talking about that I think are really important are some of the new multi-wave high-end laser therapies that are out. Those are I think we've been using laser therapy for 20 years, and we've just brought in a new high-end, kind of a cutting-edge, patented approach for laser, and we've already been seeing really outstanding results with that. An example of that would be a patient that we've just been working with over the past 2 weeks. She's had pain for about 4 or 5 months that has been unable to be touched by anything. She's had injections into her spine, medication management. I've had her had consults with specialists for injections. She's had a physical therapy consultation, and she also had prior chiropractic treatment with a different kind of a laser and some manual therapies. And when she came in, one of the things that we coordinated for her was kind of a safety net in case that what we were doing was not working. And so we were coordinating her care with a medical provider that could provide injections and medication if we needed that. But she actually started responding to the new laser therapies that we're bringing in now within the first session. So she was able to get up out of bed. Actually, she said that she was fearful of getting out of bed in the morning because of the pain and the spasm.
Mm-hmm.
But she actually responded very well, and she's continued to respond over the course of 2 or 3 additional laser therapy sessions. So once we are now breaking the pain cycle, now I can revisit with her the next steps, which are the steps of reconditioning, how to make sure that she's doing the things to try and make sure that she is not falling into the trap of recurrent pain or recurrent
Yes.
problems.
Yes.
And in her particular situation, she's had many back pain episodes before and other treatment. So, not having the right exercise, even way back when,
Mhm.
during the first episodes, really just makes us much more suspicious and concerned about the fact that she actually has deep spine weakness. That the weakness and the muscle atrophy are one of the reasons why she has recurrent pain. And so, rather than just coming in and giving her treatment to control the pain, we're opening up a conversation about how to make sure the pain doesn't come back again. Very important. And that's where the reconditioning work comes in. We have actually pioneered new strategies based on the way that the muscles actually work, with kind of a system that patients are following that really it really couldn't be any easier.
Mhm.
And so when they're starting to do that and they can actually extend that into home in a way that's manageable, that's not taking over their life or having to find mindless lists of repetitive exercises that don't seem to make any sense for them.
Yes.
And they can start exercising the muscle the way that it works and feel better doing it.
Yes.
Then we actually have a much better picture of success. So taking patients from treatment and into fitness and training is a really important step. I think that everybody that's having treatment for back or neck pain should be having this conversation with their provider. We provide second opinions to try and open up the conversations for this to happen with providers that patients may actually have well established and like very well.
Yes.
But we're using the cutting edge research to try and drive better treatment strategies for patients, and the responses have been really good. The patients not only are getting better, but they're eliminating recurrent pain. They're managing some other symptoms kind of underlying it, like stiffness and soreness at home without treatment. They're staying off of medications, and other doctors are now using the same strategies in their practices all over the country. So, I'm really kind of humbled and proud of the fact that the work that we're doing for patients in my office are being adopted by some of the best spine care centers in the country, and we can then use those same strategies to try and help other people outside of my direct
Yes.
care.
I love that.
It's good.
And Dr. McMillian, for the people in the area uh, who are listening, who are dealing with pain or know someone who is, could you share your information, how they could contact you and learn more?
Sure. There's a couple of things. I invite people to contact me, even just to open up a discussion about what may be right for them. We're also available to consult in office. But my website is proactivespine.com. That's my clinic site. They can read about me and what we do there. And then there's an info link there. It's info@proactivespine.com, where they can submit a question or post a concern where we can respond and try and help people that are either in our area or outside of our area make better decisions so that they can promote their own personal health in a more natural way.
Yes.
The system that we've designed with the fitness end of care is called Centriforce. It is a system of kind of a step-by-step approach in conditioning. It's a very easy approach, and they can also go to centriforcepro.com and post a question there. We're currently revamping that website, but they still are able to put an email in, and we'll respond back to them about conditioning and things that are important from the fitness side, so that they can be taking better personal steps for themselves, and or open up conversations with their own doctors.
Yes. I love
So,
it.
and Centriforce is spelled CENTRIFORCE. But those are two directions. So me personally, or through that, we will respond and open up conversations that they can use to try and make sure that they're taking steps that are right for them and promoting good health in a natural way.
Yes, yes. And, I know how, working with you, I've come to you, something's gone on, I'm hurting, traveled, and you do more than just say, okay, let's do this. You say, okay, let's practice this at home. Let's do this. And I would love to ask you, because you mentioned nutrition.
Mm-hmm.
So, how does nutrition play into helping your body heal from an injury or relieving pain?
Well, my family sometimes makes a bit fun of me, but I supplement my diet with a range of vitamins and minerals and supplements. Because I think it's important. I think it's common sense to know that if you put Miracle Grow on your tomatoes, it's going to grow better. So if you put the right things in, it's going to make a difference. If you put food colorings and dyes into roses, they turn the color of whatever you give them. It really is common sense that we are absorbing from our environment that way. So nutrition is very important. I think of it as some of the basics. I think earlier in the show we talked about really returning to the basics as a good starting point. So sleep, your hydration, good clean water, good diet, healthy diet, stress reduction, movement. Those are all things that are good clean air, by the way.
Yes.
But those are all things that are important to try and make sure that you're promoting a good health as a foundation. We handle the movement side of things very well. We also help patients with some of the nutritional sides of things. So in terms of pain relief, some of the things that can be done are following an anti-inflammatory diet. It's very easy to find anti-inflammatory diets now online. And there's some things that actually promote an anti-inflammatory effect, which is a chemical effect of inflammation in the body. And there are some other things that can help supplement that as well. In terms of muscle and joint pain, things like fish oil and glucosamine can be helpful. There are other things that help out as well. One supplement that we recommend for inflammation and that I take every day is called curcumin.
Yes.
Yeah,
I love it.
well. Some of the research
Me
on that
too.
is showing that it's actually being studied and or used for things like inflammation around spinal cord injuries and things like that. It's an extract of turmeric, which we've known for the longest time has anti-inflammatory properties and
Yes.
effects. And so those are some of the things that we can use to try and help drive some anti-inflammatory effects in the body.
Love it.
Natural muscle relaxant, for example, would be chelated magnesium. I was giving a opioid alternative lecture to a group of about 100 medical doctors just this past year. One of the co-presenters was a professor at the University of Washington who spoke about the fact that muscle relaxants as a prescription are really not that effective. She's a medical doctor teaching in the medical program up there and was really talking about the fact that muscle relaxants are often anti-seizure medications that really don't work on the spasm pathway very well.
Mhm.
And she was an advocate of using chelated magnesium,
Yes.
which is a natural muscle relaxant. You can't take too much because it also has an effect on the bowel, so it can be have a laxative effect. But if you just take the recommended amount on the supplement bottle that you're using, that has a natural anti-spasm or muscle relaxant effect. So there are alternatives to that
Yes.
that are important. So we have those discussions with patients as well. But I think that there's a lot that can be done for people to try and make sure that they are not missing obvious common steps
Yeah.
for pain relief, for functional fitness, for options for pain control other than medications. So
And-
all those things are important.
And isn't it great that individuals can do these things and make a difference in having the better health and relieving the pain? We have about 2 minutes left. What last words do you want to share with everyone, Dr. McMillian?
Well, I think that some of the things that we talked about earlier, such as it's really never too late to start. I think that it's important to try and make sure that that no matter what your starting point is, that you really can step into a more natural way of doing things. Make sure that you're not missing the basics, and having those same conversations with your doctor, regardless of what your provider type is, whether it's medical or alternative. I think it's important for people to become their own best advocate,
Yes.
so that they're actually asking the right questions, not being afraid to ask questions of their healthcare providers who are really there to help them. We're working for you. So it's really important to come in and make sure that you are being a good advocate for yourself and really never stop being a good advocate for yourself. And then lastly, reach out to second opinions and good quality resources. Be careful about what you read on the internet. Some of that's not screened well. Some of it, anybody can put anything on there. But I will tell anybody that chooses to reach out to me personally or any of the directions that we've talked about at proactivespine.com. my site for my office or centerforcepro.com, all of that information is based on the clinical research that's published by the National Government Resources for Research and the medical main research libraries.
Yes.
So it's really important.
Oh, thank you so much for all you do for so
Thanks,
many
Paula.
people.
Thanks for having me.
And
It's
thank
been
you.
a great time.
Bye.
Fantastic.
Thank you,
Okay, thanks
Austin.
you.